Alison, thank you for coming here today to talk to me. I'm Luke Cascarini. This is Gary Warburton.
Good morning.
Good morning.
Would you like to tell us about the symptoms you have?
Well, I've been having trouble for a few years, and mainly the dentist noticed it more than I did, and can't go to the dentist, obviously. I can't open my mouth very wide at all. It got worse, and so uncomfortable, and then I started getting pain in my jaw and my head, and I just thought, you know, something has to be done, really.
Yeah.
Can you show us how wide you can open your mouth? That's it. And is that painful?
It hurts, yeah, and it sort of, you know, sends a bit of a pain up my head, and I just find it very difficult eating, and you have to tip food in off a spoon, and just basically speaking as well. People say I mumble all the time, you know, and I find that quite difficult, and just basically very uncomfortable.
And when did you become aware that the problem might be related to your jaw joint?
Really, when I went to, well, the dentist said obviously it's, you know, you can't have your mouth, so it's probably your jaw. I was a bit worried, thought, you know, I need to go and see somebody, so I went to see Mr. Hugh Davies, who referred me on to you and said, you know, no option really.
And you mentioned a couple of years? 2 years this has been going on?
Yeah.
Okay.
I mean, it's sort of, I hadn't really noticed it before, but I think it's probably been there, you know, more. I mean, because at one point they gave me, when I went to the dentist, they used to put a thing in to hold my mouth open, and then I can't get that in anymore. You know, so basically I haven't been to the dentist for 2 years. So.
And what are you hoping that this surgery can do for you?
Well, I hope I'll be able to eat properly and enjoy my food again, and not have the pain is the main thing, and go to the dentist, which I never thought I'd say, because I hate the dentist. But
tell us a little bit about the pain. Is the pain there all the time?
Basically, yeah. It's like a sort of a toothache, you know, or sort of down under here.
So you're never pain-free?
No.
And what's the least amount of pain on a 0 to 10
probably
scale?
Sort of 4 to 5, something like that. And then sometimes it goes up to about 8, 9 if it's really bad.
And what makes it worse?
I think usually when I've been concentrating a lot, because I do grit my teeth, which probably doesn't help. And it's, you know, you're sort of like this, and that is really bad, you know. And then you just want to sort of, you know, like this all the time.
Okay.
Could we have a look at your hands, please?
Yeah, sure.
Thanks. So you've got some signs of a type of wear and tear, sort of arthritis of your
and then my knees are quite bad as well. But then they are very painful as well. Yeah.
Because the same condition is affecting your jaw joint, and it has a similar effect. It restricts the movement and causes pain and swelling. So what we're proposing is to remove the joint and replace it with a custom-made joint, which is made of a combination of titanium and high-density plastic, essentially.
Yeah.
And that will be put where your damaged joint is, with small incisions in front of your ear and in your upper neck.
So this is an example of what we'll be using. This isn't your model, but this is the identical custom prosthetic joint. And it's screwed to your jaw here and here. And we do it through 2 incisions. The first incision is in front of your ear here, which you'll virtually it'll disappear.
Yeah.
And the second incision is down on your neck, it's about this long, just down behind the angle of your jaw.
Okay.
And we use those 2 incisions to get this into place.
And you just sort of slide them in, or?
They're slid in and then we screw them into place.
Brilliant.
Yeah.
Looks amazing. Will I be able to go through the airport?
You will. Yes. People sometimes worry, you know, like about the airport, or does it feel different? But most people who've got these joints don't, once it's all healed up, you know, after a few months, maybe up to a year, people don't really notice that they're any different from just...
And will it change my face at all?
Not significantly.
No.
You'll feel it if you're thin. If you feel over the jaw, you'll probably feel the metal component, but you're not going to notice it in appearance.
But you won't feel it from inside or anything?
No.
No.
And no one will be able to look at you and see any difference.
Okay.
And when you're opening your mouth, what you'll notice is your jaw will deviate rather than opening straight, and that's entirely normal.
Yeah.
Because this artificial joint doesn't slide like the natural
No.
joint. So you have one side that's sliding normally and
Yeah.
the other side is hinging,
Okay.
and that results in a deviation when you open, and that's entirely
Mine
normal.
deviates anyway. So.
Yeah.
Yes, yeah, yeah. Just to give you some perspective, in the US there are 1.5 million knee prostheses done per year.
Yeah.
TMJ prosthesis is about 1,000.
Wow.
So there's a huge difference.
Yeah. That's amazing.
But it's the same material, it's the same quality. It's all
And is that quite heavy? The,
not really. I mean,
it's not
most of the
bad,
weight
is it?
is this.
It's quite thick, isn't it?
Most of the weight is a plastic.
Yeah.
Yeah. I guess we can talk a little bit about the post-op. So initially on the recovery, you're going to be on a liquid diet for the first few weeks. And then you'll progress to a soft, mushy, non-chew type diet.
Okay.
That's typically for about 4 to 6 weeks
Okay.
before you can advance to more of a normal diet.
My God, I want my steak.
Yeah. And then we'll have you start doing some stretching, some physiotherapy on your own at home, probably 4 times a day.
Yeah. Is that straight away?
That's going to be starting in a few weeks after the
Okay.
initial pain subsides.
Okay.
And then you'll just begin stretching, and that'll gradually increase your mouth opening to a more normal range.
Right.
You'll probably have certainly 1 night in hospital, and if you do well, you'll go home tomorrow.
Good.
Some people require 2 nights.
That's
We'll
okay.
just see how you do.
Prepared for that.
Typically we will sometimes use a drain that comes out, and if we do, that will be removed tomorrow. We don't always use that. From a patient perspective, is there anything that you want to know, any questions that you would ask?
Yeah, just a bit worried about the anaesthetic because obviously you can't put a tube down my throat. So I just wonder what you do there.
Yeah, the anaesthetist will talk in detail about that. But we'll typically put the tube through your nose using what's called a very fine fibre optic endoscope technique to look down into the airway rather than opening your mouth and looking through your mouth, because we can't do that.
Yeah.
But the anaesthetist will explain that in much more detail.
Okay. Yeah, that was just one thing that was worrying me. And how long will it be until I feel absolutely confident with it?
Probably within a few months, when the
Usually-
swelling's gone down. And
Yeah.
Yeah,
your
usually
pain.
6 to 8 weeks to get over the surgical recovery, but
Okay.
actually the tissues remodel and heal for 6 to 12 months.
Okay.
So you'll notice some little incremental improvements up to 12 months.
Okay. That's fine.
The majority of the healing is within the first 2 to 3.
Well, I think I'm just, for people, it's important if you feel anything sort of odd or whatever.
Yeah.
Or you are having pain, because I think, or it's just because I grip my teeth or something.
Yeah.
That you should sort of go and see the doctor or the dentist, really. And I was just lucky that mine picked up on it so well. I mean, I always have my 6 monthly checkups. So, but I mean, luckily I have the same dentist, and I mean, it was the headaches really that got me. I think once I nearly blacked out. I mean, it's hard to get your dentist to understand that actually you just can't open your mouth. But he was very understanding.
And that's actually the primary indication for the surgery,
Yeah.
is to improve the function. The pain hopefully will also improve to a manageable level, and we'll manage the pain. And hopefully it'll be a good result on both aspects, function and pain.
And it's fine. I mean, you can go on eating off a teaspoon, but it's it's not much fun, is
nice,
it?
is it?
It's embarrassing when you go out and things. So it's nice to have it, done. So how long will the jaw last? Will I have to have it replaced again, or
It's possible.
possible?
With knee and hip prostheses, the life expectancy is 10 to 15 years. This particular device has been on the market and in clinical use for almost 30 years, and we haven't seen that pattern of failure
Okay.
due to wear and tear.
Yeah.
It may be that we just haven't followed patients long enough. It may occur at 40 years,
Yeah.
but the device may well last you a lifetime.
Good.
The 2 most common reasons for reoperation are number 1, infection. That's less than 2% chance.
Yeah.
If that happens, then it means probably 2 more surgeries
Okay.
to clear the infection and put a new joint in.
Okay.
The second most common complication, which is less than 1%, it's actually 0.8%, is extra bone formation. It's called heterotopic bone.
Right.
And that's just a bony overgrowth around.
Okay.
And they're the two most common complications that require reoperation.
Okay. And what about the other side? I mean, do you think that would get the same problem, or?
Well, about 60% of people might have joint replacement surgery on the other side at some time in their life, but it's not something that would necessitate considering surgery unless you have those symptoms and problems. So some people find that the other side actually gets better when the worst side is improved, and some don't. So we just treat the side that's causing the problems and wait and see.
Good.
Had anything to that? Or?
No, I think that's correct. It's uncommon, but it can happen.
Yeah. Okay.
It's probably less than 20% chance of the other side becoming symptomatic and requiring a joint replacement.
Okay. That's good news then.